Ladies and gentlemen, welcome back to the Doc Talk podcast with Dr. AJ and Dr. MJ. What up,
Let's go, baby.
How you doing, baby? Bro, we have a special guest today, Dr. Faisal El-Jabali.
Let's go.
He is an ophthalmologist and a retinal surgeon. So we're really excited to have him on our show. We've been waiting for this for a long time.
Everyone's been asking about it, but I just want to clarify something. These are not implants.
Oh, thank you.
And he's not a plastic surgeon.
Yeah, so let's flip them over. They are. They're not implants.
Thank you for bringing these because this is great.
My pleasure.
Great,
I'll bring implants anytime.
Yeah, exactly.
So why don't you tell us a little bit about yourself?
So I'm a retina surgeon in the Tampa Bay area. I'm actually excited to be here. I've watched your podcast for a while now.
Thank you, man.
Thanks.
The Jibawi Brothers just kind of kick it. And I'm excited to bring in some informative, fun way about the eyes and kind of educate the public about it.
Yeah.
So I'm a retina surgeon in Tampa Bay and an ophthalmologist.
It's amazing.
Specialize in diabetic retinopathy, macular degeneration, floaters, that kind of stuff.
We have a lot of questions just because patients ask us questions, and not in a bad way, we really don't know enough about the eye, I feel like, as primary care. That's why we brought you on, so you can help us out on it.
Well, we can't do this. The specialist and the primary care got to work hand in hand.
100%.
It can't be just me by myself.
Yep.
And the best care for the patient is when we work together. You control the diabetes, we control the visual symptoms, swelling in the eye, but it won't work without you helping control the diabetes.
Yeah,
Of course. I mean, the question that I've always had is, when is it as a primary care doctor, when is it for us is the best time to say, you know what, it's time for me to send you to the ophthalmologist or the retinal surgeon?
So they always need an annual dilated exam.
Okay.
Because
Especially diabetics. Yeah, that's why we do the annual
Can
exam.
you explain to them what a dilated exam is? I mean, just kind of a quick summary.
So dilated exam is basically we're looking into the back of the eye.
Okay.
So we put drops in the eye to dilate the pupil in order to check the retina to see if there's any bleeding, any swelling. And those are the things that could be visual threatening in the future. If there is no bleeding, no swelling, then we're good.
Gotcha.
If there is, then we got to approach it and treat it. Whether it's by treatment in the eyes or whether it's treatment with you controlling the sugar, eventually the patient has to watch out for themselves.
Yeah.
They have to control their own sugar.
Get their A1C under control. When do you start panicking with A1Cs, like especially with diabetic retinopathy?
So what's recommended is an A1C of below 7.
Okay.
Once it start going above 7, it's only a matter of time before they get swelling in the macula.
Yeah.
And blurry vision.
And do these so that's what it is basically. These patients start developing blurry vision, right?
Yeah.
Is there any pain involved?
Pain and blur, no. You
No,
just lose
okay.
your vision.
That's the
what
problem.
vision
I watched a video earlier today. That's what they were saying. The scary part about it is that you don't even know.
Yeah. A lot of
Yeah.
You
times.
go years without getting an eye exam, and then all of a sudden,
Yep.
that's
It
when I
could
was
steal your vision
it's
without knowing.
scary.
Well, that's why we push our patients to get their yearly eye
100%.
checked. Every single year, you have to get your eye exams to prevent this situation.
100%. That's why when I saw that the age between age 25 and 65 is the #1 cause of blindness, I was shocked.
Yeah,
Yes.
it's
That's
terrifying.
like, between that and macular degeneration, man, that's the biggest
Yeah.
leading causes of blindness. That's
Yeah, it
scary.
is.
And that will scare people. Like when I'm trying to scare my patients, I tell them about blindness. Do you want to
Yeah.
go blind? And it's not a joke.
Yeah,
Like,
it really isn't.
You see this.
Oh, I see this daily. I mean, I saw a patient today. Her sugar was uncontrolled for years and years and years. And then she comes in today and she lost her vision.
Wow.
And I look inside, she's got a detachment from tractional scarring from uncontrolled diabetes for years.
Wow.
And at that point, the only thing that could help her is surgery. But had she controlled it over the years, whether it's treatment or controlling the sugar, she would have never gotten to that level.
Yeah.
They walk in, though, expecting just a pair of glasses.
That's
Yeah,
what everybody
of course,
thinks.
Of course,
They
an
think when they're going to
injection
see
or
you, it's just,
procedure.
give
Yeah,
me
fix
glasses.
me. Yeah, fix me.
They don't
It's got
understand.
years of damage. Then they want to get fixed. Within one visit.
I think also people are a little bit scared of the needle to the eye, man. I don't know. I just would feel scared. Like, are people usually scared to get
So-
shots in the eye?
Of course, I mean, an injection in the eye, it's not, we usually try to not say the word injection.
Yeah.
Injection in eye should not. They're scared.
Don't want to get injected. But, there's ways to do it. So the way I do them is, we numb the eye nicely. The patient never sees the needle. A lot of times, or actually 99% of the time, the patient walks out of my room not knowing they got the injection.
Oh, that's
Wow,
awesome.
pretty awesome.
Just got to do it in a smooth way, just like a magician.
Yeah,
I
that's
agree.
actually very
I
smart.
agree.
That's
I
so you don't
agree.
want them to panic right before doing it.
Yeah, because they will never come back.
You
They
just
need-
blur them out.
Yeah, exactly.
No
Blur it out, I
idea.
have
Just
no
don't do
idea.
it when they can see.
yeah. But you come from below, so they really don't see the needle coming, and you numb it very nicely. And then eventually, when you give the treatment, they don't feel anything.
Okay.
Yeah,
How
nice.
big are the needles? Just
It's
wondering.
the needles. There's different sizes, but
Yeah.
usually it's a 31 gauge.
Okay.
It's
it's
very
pretty-
tiny.
tiny. Yeah, that's so small.
I use a
Yeah.
lot of 30 gauge for like our procedures and stuff.
Yeah,
It's a
that's
tiny
so
needle, like a
tiny,
half inch.
yeah.
It's very tiny. Yeah. So you do tons of these in your office. I'm assuming that's
Oh,
pretty much all,
yeah.
all day, right?
Injection left, injection
Yeah,
right, injection left, injection
Yeah.
Both
right.
hands, right? It's trying to two patients.
Just like
And
an
What,
NBA
what are the
player.
injections doing? Just so
The
that we can
injection
understand.
mostly is an anti-VEGF, anti-vascular endothelial growth factor.
Okay.
What it does is your center of vision is blurred out from swelling or edema in the macula. The anti-VEGF decreases the swelling and controls or stabilizes your vision.
Oh,
Okay,
that's what you're
nice.
saying. And how often do patients need to get these injections? Pretty much.
Typically every 4 weeks,
Okay.
Wow.
For how long? Wow.
as long as there's swelling.
Okay.
So to
I got you.
get rid of the swelling, you're
So
doing.
is it- okay.
If there's
If
no swelling, you
If
don't.
there's no swelling, there's no need
No
for
need for it.
injections,
Okay, that's pretty cool.
which is called diabetic macular edema.
Yeah.
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 Can you with not these implants, with these props that you
Eyes
brought for
wells,
us,
yeah.
can you kind of maybe show the camera a little bit of just what the anatomy is? Show that camera right there and kind of show them a little bit of what we're
So
looking at here.
So this is the eye in general. This is the front of the eye. This is your cornea. Going back a little bit, you have the lens where everybody eventually will get a cataract. Further back, you have the vitreous cavity. And then all this orange stuff is actually all your retina. Within this whole retina, there's a small spot in here. It's called the macula.
Yeah.
And that's where the majority of your central vision is, and that's where the swelling is. So the treatments that we do, and the bleeding really is all the way in the back of the retina. So this is all behind, and that's why we need a full dilated exam.
Yeah.
And to rule out any bleeding or swelling. And then at the end, there's the optic nerve, and this nerve is what connects the eye to the brain. It's kind of like a cable between the eye and the brain.
Nice. Okay. So when you do the injection, I mean, what's your typical, process?
My typical process, which I found out, and I've done this hundreds of thousands of patients, the typical process is to start by topical drops for
Okay,
starters. So I
initially.
kind of put a few drops on top.
Like an anesthetic?
Correct.
Okay, got it.
Topical anesthetic drops. And then what I do is I go under the white part of the eye with a small injection with subconj lidocaine.
Okay, nice.
And that part numbs the eye further. So there's
Gotcha.
first step,
Of course.
topical eye drop,
and then okay,
underneath.
on the inside.
And give them then 5 minutes. And then I come in and I do the injection. Usually the patient is looking upwards.
Yeah.
So when I come at the bottom part, they really don't see anything. Do the injection and then done. Out of there.
Wow, awesome. And
Obviously,
do they get
we're
instant
using-
relief?
No,
Typically,
it's
some
not.
do some not really. Not,
It's
not
not
like that?
instant because the medication kind of stays in the eye for about 3 to 4 weeks.
Oh, gotcha.
Okay.
And hence the need every 4 weeks to repeat it.
Yeah, makes sense.
Makes
Reduce
sense.
the swelling and the edema. So,
Yeah.
okay.
And you were talking about cataracts, like in between. We're seeing it so often. Is there
Yeah.
something that's? I mean, every one of my patients is getting cataract surgery.
Everybody on earth will get
need
a
one?
cataract.
Okay,
It's
for
just
sure.
a matter of age.
Matter of time.
Yeah.
Okay.
Yeah,
Yeah.
for sure. And diabetes, of course, affects it. Right. That's
Diabetes
important.
definitely affects. It gives you a unique kind of cataract.
Yeah.
And it definitely affects the lens as well. So it'll speed up your cataract process.
Okay.
Awesome,
Makes sense.
Awesome.
It's amazing. The eye is like a camera. Any part of the visual axis that's affected could affect your vision.
Yeah.
Whether it's the cornea, the cataract, bleeding in the vitreous,
Optic nerve.
macula, anywhere along this axis could affect your vision.
Yep.
And even brain injuries.
Oh, brain injuries as well.
Yeah. And when they do get the brain injury, is it affecting mainly the optic?
It could affect the path, the neurologic path, because it's all connected in the back.
Okay.
Yeah.
So it'll be more of a stroke or
Yeah. A lot of them. Yeah.
depending on the location in the brain that's causing this.
That makes sense.
Do you when you get these patients, do you usually have them stop their aspirin or Plavix or any blood thinners that they're on before you do this type of procedure?
I typically don't. There's
Okay.
no need for that.
Okay.
Sometimes very rarely, they get like a little subconj bleed,
Yeah.
which is on the surface. It's purely cosmetic,
Yeah.
and it goes away. It's
That's
good.
why the clearance form always says,
Yeah.
no need to stop aspirin
Yeah.
on every clearance form.
Yeah, exactly.
It's good for Halloween.
Yeah, exactly. Scary eye.
Yeah, conjunctival hemorrhage. There's a lot of patients that come in with conjunctival hemorrhage. I'm like, I woke up like this. I'm freaking out.
And they're scared. They're, I don't know what to do.
Yeah. They're freaking out. I mean, honestly, I usually tell them to hold the aspirin just for a couple days.
Yeah.
And that's what I typically tell them, just in case, if they're on aspirin or Plavix. But I tell
Especially if
them
they
to hold
don't,
it for a couple
if they don't have any.
days, if it's excessive. And then after that, I just tell them to kind of restart their medication. So
Aspirin is notorious to cause some conjunctival bleeding.
Yeah, for sure.
I mean, that conj bleeding is typically from rubbing the eye or
Yeah.
straining, or being on blood thinners in general.
yeah, for sure. That's all. Just a risk alone, just being on blood thinners, for sure. Definitely.
Purely
Awesome.
cosmetic, though.
Yeah.
Great.
It's not doing anything.
No.
No.
Looks good sometimes.
Yeah, it looks scary.
Where is your office located?
So I am in Tampa. The address is 4178 North Armenia Avenue. Happy to take care of you guys right in the center of Tampa.
Yes.
Would you hook me up with a free eye exam?
Oh, you got it.
Really? Promise?
Come in tomorrow.
Yeah?
What if I don't have insurance?
You got it,
Hey,
man.
you'll take care of me? Promise?
Just for you.
Just
bro.
for you.
Wow.
He's
We are
already
recording
saying this to everybody. We're going to have a line of people outside your office tomorrow.
Free eye exams?
I
Cash
saw you at Doc Talk.
cash
Put it on
only.
there.
Cash only.
Disclaimer. Only AJ.
No headaches with the insurance. Cash
I
only.
know, it's so much easier, isn't it?
I wanted to ask you, because not many people go into ophthalmology, and it's not that it's a bad thing. It's a very hard field to get into. It's not easy. People don't understand it. Like, it's the eye, but it's a very hard field, especially, retinal surgery. That's not easy. What made you want to get into that? Like, what was something that?
I mean, honestly, for me personally, I
what
knew
caught your eye?
what caught my eye.
That's a good
For me,
title.
it was early on. In high school, we dissected an eye,
Yeah.
and I was like, that is fascinating.
Yeah,
Sure.
And then you kind of look at it. We only see the outside of the eye,
Yeah.
and then when you dissect it, you're like, wow, this is amazing.
So much inside.
So much more involved. I mean, you could look into the soul of somebody.
Yeah,
you
for
know?
sure. For
You
sure.
got diabetes, you got high blood pressure, you got a stroke, you
yeah, you
have
look-
heart problems. You could see amazing stuff. And then in undergrad, you have to work hard for it. So in undergrad, I did research, in particular about the cornea. And then in medical school, I did further research, and I was trying to figure out a way to measure the eye pressure subjectively or objectively.
Yeah.
So I did research in my first year of medical school, and then I got published in the Retina Journal and the New England Journal of Medicine.
Oh, I love the new. That's my favorite. Yeah.
Also early on in medical school. So between all that, the passion, the drive, you have to have the passion and the drive initially for any field you want to go into.
100%.
Between all that and then, good rec letters and all that stuff, it leads to getting what you want.
100%.
You just have to focus on your goal and keep going at it.
Yeah.
What recommendations would you give people to keep your eye healthy? Like, what are some, obviously controlling your sugar, exercising, getting blood supply to the eye and stuff like that. What are some?
So keeping the eye healthy, definitely. I mean, we're in Florida, it's sunny, but you got to wear your sunglasses.
Okay.
That,
Keep your
UV
eyes
protection, because that could lead eventually to what's called macular degeneration.
Yeah.
Eat healthy, kale, anything like, antioxidants, all that stuff kind of helps. Get your yearly exam, get your dilated exam. It's amazing how many people come into clinic because they got referred to me as a retina specialist because a primary eye doctor saw a retinal hole, a retinal tear, just, asymptomatic. Then they send them to me and I take care of it before it gets to the level of a detachment. So once you do your annual dilated exam, and just any symptoms that come up, make sure you check it out. Don't ignore it.
I feel like people, especially with the eye, they just wait until there's a problem. They're not
That's the
I mean,
majority of the
including
people.
us, how many times have we done an eye? I haven't done an eye exam in a while.
Yeah, me neither.
And I feel like it's a little, people need to start taking it a little bit more serious. I mean, that's the most important thing.
It's true. I mean, I notice it in clinic. Typically, the macho guys are kind of saying, oh, forget it. This is just a little blur in the periphery. It's not bothering me. It's no big deal. And then next thing you know is like they lost their vision. They should have came in day one.
Yeah, for sure.
And then you have, the ladies, on the other hand, they have a little floater in their vision. They're right in there.
Floaters. Everybody always wonders about floaters. Should they be considered? Like, should they be
Floaters.
concerned about? Yeah, floaters.
When they first happen, yes. Because if they're new floaters, we gotta rule out any tear or detachment in the periphery.
Got it.
What happens is the gel with age, the vitreous gel in the back of the eye, liquefies. And as it liquefies, it pulls on the retina. Most time it just kind of releases and gives you these little black spots. Sometimes it pulls too strong and causes a tear or detachment.
Yeah.
So if I look in, on a dilated exam and rule out a tear or a hole, I could laser it in the office before it gets to a level of a detachment and losing your vision.
Gotcha.
I get floaters all
So
the time.
anytime new floaters, come on in immediately.
Yeah, I need to come in. I got floaters right now.
Do you specialize in cornea at all?
No, I focus mainly on the
On
retina.
the retina? Yeah.
The floaters, most people are bothered by it, but 80% of the people, they get used to it. Their brain suppresses the image.
Yeah.
20% are extremely bothered by it, and those are the people I could take it out surgically for them.
Okay.
Nice.
So there's options for treatment.
Perfect.
Okay,
Perfect.
that's awesome, man.
Dr. El-Jabali is board certified in ophthalmology, and he's also a surgical retina specialist, correct?
Correct.
Awesome. Well, we're really, really glad to have you on our show. Is there anything else that you want to recommend to our followers, to our viewers, to your patients that are probably going to watch this?
Yes.
Oh, man. Do your yearly exam. Work hand in hand between your primary care doctor and the specialist. Do not ignore any visual symptoms. Come on in. We have a fun environment, kind of like the Jibawi podcasting clinic.
Nice.
Awesome, man.
We're just doing.
You fit in perfect, honestly. Man.
We're just having fun in clinic. We do injections, but we're pretty much, me and the patients are laughing about it.
I love it.
After the first
maybe
one.
we can do a recording one time in his office.
That'll be a great idea.
We'll do like a
Have those
visit where I'm going to
procedures.
get my
Yeah.
eye
Oh, yeah.
examined.
Yeah.
We'll do an
Well,
injection on you too.
Yes.
Exactly.
Just make sure my eyes are black.
Exactly. Well, we
I
got to
can't
fix
see
the
anything.
mustache initially, kind of to the other
Random
side.
thing. Have you seen a show called C?
See? No.
C.
Oh,
it's on
that's-
Apple
yeah.
TV. It's about like a whole bunch of people that are like, after like there was a bomb and then they can't see. The whole town can't
Oh.
see.
Yeah, they're
Wow.
all blind.
It's
Everybody's
all blind.
My God.
Except like these two children that can see, which like they're like,
Yeah.
Wow.
That's
If it's the whole town, I got to open a clinic.
Yeah, exactly.
Oh,
Exactly.
I don't know if you make tons
You'll
of
do
money because
great.
I don't think money even matters.
Yeah.
Cash only. Cash only, bro.
Exactly.
You'll do great. Cash only.
Cash only.
Gold only.
Gold
I love
only.
it. I love it. I love it.
Make
man.
sure you guys subscribe to the channel, comment. Let us know if you guys have any questions.
Yes, we are going to leave Dr. El-Jabali's information below at the end of the video. Thank you so much for joining us today. We are so happy to have you on our show, and we'd love to see you again in the future if that's okay with you.
Thank you for having me, and I'd love to be on here again.
Awesome.
Awesome,
Pleasure's
man.
all
Thank you
all
so
ours,
much, man.
Honestly,
Awesome.
thank
I
you.
appreciate
man.
it.
It's nice seeing you, brother.
Love you.
All right,
Thank
thank you.
Thank
Thank you so much.
Thanks, man.
Thank you, man.
Don't make fun of AJ's bald head.
Oh, no, I won't.
That-
I won't.
Leave that
The
to me.
fastest growing hair.
I'll take care of that.
It's all good. Bald is sexy.
Bald's the new sexy.
Yeah,
It is.
sexy.
It is.